In the beginning of mankind, the bar was pretty low when it came to our lifespan. You'd be doing pretty well if you made it past your 30s. Nowadays, with the right diet, genetics, and health regimen, many of us can live until we're in our 80s, 90s, even past 100. A big reason for that has been the evolution of healthcare. And for the better part of the last century, the evolution of our healthcare has been driven by research and advances in technology. And this progress feels like it's only just getting started, and we can predict its direction. So, who wants to stay ahead of the curve? In this video, we're talking about healthcare jobs of the future and how you can start training for them right now. Hello, future healthcare professionals. This is Talking Jobs, and I'm Mary Williams. In this video, we're looking at healthcare careers of tomorrow that you can prepare for today. If you're about to pursue a degree for a healthcare or life science career, you may have realized that your field might not look the same by the time you get into a lab or clinical practice. With the adoption of more technology, artificial intelligence, and telemedicine, virtual care, the healthcare landscape is changing at a rapid rate. But if we put on our future glasses, and there we go. When we put on our future glasses, we can see a number of careers that will still be at the core of medicine and biotechnology tomorrow. Well, not actually tomorrow, more like the near future. Unless you're watching this video in the future, then it might literally be tomorrow. Well, anyway, let's start with some pathways that are already well known, but will continue to play a big role in healthcare moving forward. It's no surprise that doctors and nurses will still be a fundamental part of healthcare moving forward. But other key roles include physician assistant or PA. The physician's assistant is trained to provide some preventative healthcare and other diagnostic advice. As the doctor shortage continues, PAs are becoming a part of the frontline medical care. The PA track is great for someone who has basic medical care training and is looking to advance. Education and licensing only takes on average about 3 years, and the tuition might not be as high as other positions. Pharmacist. We see pharmacists prepare, package, evaluate, and administer medication prescribed by physicians. What we don't see is that they are also part of the routine hospital care and can specialize in various departments. In addition, they can contribute to pharmaceutical research that play key roles in treating diseases and even cancer. Pharmacy school will prepare you for your boards, clinical evaluation, and potential pathways. Up next, physical therapists or PTs. Physical therapists help people recover from mobility issues, relieve pain, and prevent long-term injuries from accidents and disabilities. You may have worked with one if you've ever had a sports injury or physical challenges. A PT career starts after acquiring a graduate degree in physical therapy. However, internships can help prepare you while you're finishing school to gain further experience in the field. Next role, Healthcare Information Technology Manager. That's a mouthful, I know. But this person is the keeper of the records and is responsible for all billing and data collection that goes into the healthcare process. With the advancements in technology, people with backgrounds in computer science and IT administration are sought out the most. Healthcare IT degrees are now available at both the undergraduate and graduate levels. Clinical Research Administrator, another data-centric role. These people are responsible for the planning and coordination of medical research projects and clinical trials. This is a very specialized field, but there are undergraduate and graduate programs that train students in clinical research. With so much pharmaceutical research and medicines being produced, this role will remain an important one into the future. Okay, that's a handful of options. But to give you more options, take a look at this list of even more. It's okay. Pause the video or take a screen grab. These are all existing healthcare pathways that will provide opportunities for decades to come. The longer we live, the more likely we'll need these workers and more like them. So use the link in the video description to learn more about those, or type them into a search engine and check them out on your own. Some require certifications and others require associate's or bachelor degrees, but all of them require a dedication for helping others and your community's well-being. Did I say something wrong? What's going on? I don't want to say we're important, but we robots and other technology are kind of having a big moment in healthcare. Let me tell you. My bad, guys. I got hyped about the Jobs of the Future title and sort of plugged in our robot replacement. I guess you can hold progress back sometimes. At least until the machines have independent rechargeable power sources. Right, you can unplug that robot anytime. Thanks, Mary. You're welcome, I think. Okay, even though it keeps trying to take over the show, our robotic friend was telling the truth about healthcare and technology. With advancements in robotics and artificial intelligence, or AI, there will be continuous changes, and in some cases, replacements of certain professions, like data entry and bookkeeping. Not YouTube hosts, though. The good news is that those same technologies will create new careers. Here are some professions of the future to consider. To start, let's talk about biotechnology and advanced manufacturing in healthcare and medical products. Biotechnology companies research, innovate, and develop scientific advances in new products in genetics, biochemistry, biology, medicine, and other important fields. If you enjoy math and science, this cutting-edge area of study may be for you. At the end of the day, you're using technology to help improve the quality of life for people. There are a number of pathways within this area. Like biomedical, our clinical technicians may only require an associate's degree, but many others, such as DNA analysts, microbiologists, or pharmaceutical manufacturer, need at least a bachelor's degree in a specific major. Speaking of cutting edge, how about a career as a bioprinting expert? These specialists are trained in the technique of bioprinting tissues and organs, which is opening new avenues for research and future organ transplantation programs. It's like 3D printing for the human body. Since this is an emerging field, the job opportunities are still growing. So do some research to see if any training programs or companies near you are active in this area. Here's one that gives a whole new meaning to remote work. Psychologists and therapists are already delivering a lot of patient care virtually these days through screens and video chat. They can also use technology to immerse people in virtual worlds to help them conquer people's fears, phobias, PTSD, post-traumatic stress disorder, and even chronic pain. Future therapists will need a background in mental health and experience in VR to design appropriate treatments. If you like your connected smartwatch or other wearable tech, this next role might be your thing. The lifestyle strategist is another patient care position that may grow in the future. This person will guide patients through all of the data their connected wearable devices are collecting and help them create a personalized lifestyle, diet, and workout routine. It's another example of how personalized medicine and custom medical services will play a larger role moving forward. Okay, one more and then we'll let you explore on your own. This next one is dedicated to our unplugged robot. It's a deep learning expert. This specialist is responsible for building and maintaining the algorithms or technical directions that power artificial intelligence applications. These applications will help advance healthcare imaging. They can be used by that lifestyle strategist to analyze the data from wearable tech. They can serve as a reassuring chatbot for someone having a mental health issue, and so much more. In healthcare, it will be the deep learning experts who will help guide and supervise the development and deployment of effective and ethical algorithms. While you're at it, maybe you can even help us make an ethical algorithm for our little robot problem, when you're not busy saving lives. Well, there you go. We've got a whole lot of healthcare careers that will continue to be in demand and important in the future, as well as a bunch of future learning pathways that you may want to look into as well. No matter what, don't just limit your list to what we show you. Let your interest and curiosity guide you, along with those algorithms. In preparing for future healthcare jobs, the best thing to do is stay up to date on technological developments through education opportunities, online courses, seminars, and workshops, as well as networking with professionals in the field. It will give you a lot of the insights you need. Your healthcare, biomedical, life science, world-changing future is right around the corner. Until next time, be well and take care of each other, even your robots. Ethics, morals, compassion. Algorithm under control. You're welcome.